I'm going to turn it over to Margie to cover a quick topic on our education and training.
Okay, thanks, Jonas. Okay, what is our big picture goal in the area of education and training? Well, if you were at the workshop before this where they were talking about we need to attract more distribution, we need to attract more producers, guess what? This is a great solution. So our big picture goal is to attract more distribution. Now, what am I referring to when I say that? Well, first of all, we have experienced LTC specialists. Okay, so this is an easy message for them to use to communicate the need about long-term care and for consumers to say, hey, 3 and 4, what is that? What does that mean? So it's a good message to communicate. Then, and I didn't even realize it, they said over half of the people had left the industry. Well, gosh, this is a great way to bring them back. Then we have the occasional producer. Well, what we're hoping to do is to give them these messages, give them these words, that we can use them, we can bring them back and say, hey, the market for long-term care is hot, the message is shifted to long-term care planning, and these are the words that you can use. We want to also expand, we want to seek producers across multiple product lines. The life producer has traditionally been our target audience, so we need to continue enticing them, but we have health, we have annuity producers, we have P&C producers. Certainly we need to go after financial planners. I think that I heard that Steve Schoenfeld said yesterday that when financial planners were asked to name the five top areas that they were mentioning to their clients, and long-term care wasn't among them. Well, guess what? We need to change that, and using the 3 and 4 message, the way it's worded, can certainly help change that. So yes, our goal is ambitious, where we want to attract and increase the number of distribution, but this is the way that it can be done. Now, what have we accomplished so far? And I'm proud to say that we have woven great relationships with several major associations in our industry. The first one is NAHU, and Farron Ross, who would just stand up and say hello. Farron is the NAHU representative, and I was meeting with Farron last summer, and she said, wow, I have this great idea. Why don't you come up with a 50-minute presentation that we can also get CEs for, and we can use it for NAHU associations across the country. It was a great idea, Farron, okay? Sally Lineback and I, Sally, just stand up for a second, hundreds of hours later, we now have this presentation. And to give you an idea of how well it works, I just presented it last week to the Sarasota NAHU chapter, and they are lining up to bring Dr. Marion to Sarasota, and they're planning a whole day of events, and we're figuring out where to park the bus, and we're having a dinner party for Dr. Marion, and a formal luncheon's being planned. And if we can do that in tiny Sarasota, we can do it in every major market across the country where Dr. Marion's going to be stopping. So there's incredible potential there, and the 50-minute presentation exists. So that's number one. In addition, NAIFA. We have a similar concept with NAIFA, and NAIFA has done a 3 and 4 presentation as part of their program in a box. And we're going to be shipping it out early next month to the NAIFA associations across the country. So they're going to be encouraging NAIFA members to show it at meetings and also to use it in other venues. And we've also done variations of this presentation where a producer can take it to any kind of organization, association. It can be geared towards agents, it can be geared towards consumers or whatever. So there's a lot of uses for Sally, the hundreds of hours that we spent on this. In addition, the Life Foundation. This is the first time that the Life Foundation has had a long-term care person to head it, and also, I'm proud to say, a female. And that's our own Deb Newman. And so we're going to be working very closely with the Life Foundation to help spread the 3 and 4 message. In addition, Jonas had talked about the Texas Partnership and HHS, and we're going to be doing, hopefully, more work with them when the dust settles concerning the budgets and the Class Act and everything like that. So, where do we plan to go with this? Well, I am open to any ideas, any suggestions. We are going to be launching and identifying our education and training initiatives. What do we need to get people into the fall? What do we need to educate them so they can use the 3 and 4 words comfortably, and then take everything to the next step? So whatever suggestions you have, please let me know, and we invite you to join this exciting effort.